She is so happy and healthy now. What could possibly go wrong? She doesn't know she's at risk for dying tonight. Did you know that over 1,050 babies in Michigan die on an average every year? Sleep-related deaths stand out as being preventable and are the focus of coalition efforts in our community. Local groups are joining together to reduce the number of infant deaths in Calhoun County. The American Academy of Pediatrics has outlined recommendations for a safe infant sleeping environment and sleep position. We want all parents and caregivers to know the steps to a safe sleep environment.
Almost all of the deaths of infants in this community are preventable. And a majority of those deaths are created with unsafe sleeping environment, asphyxiation, where they're put in the wrong sleeping quarters, they're put on couches, they're put in beds with parents, or the crib that they're sleeping in is unsafe. And we think that bringing the community together and the leadership and the populace of Calhoun County, that we can greatly reduce the infant deaths.
At our Family Birth Center, every baby is important to us. And when we hear of an infant who has died, it's rather heartbreaking. We would like to do everything possible that we can do to help prevent any unnecessary infant deaths in our community.
We believe we can make a difference for babies' survival by providing the community with knowledge, skills, and resources to protect babies. We want to include parents, caregivers, healthcare providers, and child care providers in teaching and modeling safe sleep practices and in providing other strategies to comfort infants and promote healthy growth and development.
Our main concern is that a baby that dies in the crib is a preventable death. And if we can educate our patients, our healthcare providers, and the community in general, we have a chance to prevent these significant tragedies.
At Oakland Hospital, we feel it's very important to be role models for our new moms and dads, and by that we promote safe sleep within our nursery, so that when we take the baby back out to the moms, they see a safe sleep environment for that newborn, and so they know when they go home that's the type of environment they need.
There are some easy tips to remember to help babies stay safe. Babies should sleep alone in a crib, portable crib, or bassinet. After feeding, put your baby back in her own crib to sleep.
We are finding that infant deaths are related to either positional asphyxiation or overlay with an adult sleeping in a bed. I have found them laying on the couch with their mother as they're nursing them, and mom falls asleep. The baby slides underneath the mother's arm or on its breast and suffocates. And of course, mom does not know she is sleeping. She does not know what the baby is doing.
The crib or bassinet should have a firm mattress with a tight-fitting sheet. Babies should not sleep on waterbeds, sofas, a soft mattress, or other soft surfaces.
Some of the mothers will say, well, is it safe to sleep with my newborn? And we really tell them that although we understand they want to bond with their babies, that it's important to maintain that safe sleep environment by having, you can have a bassinet or a crib or a pack and play in the room with them so they can still hear the baby if the baby needs something during the night, but it's still a safe environment for them, for the infant.
It's fine for a baby to fall asleep in a bouncy seat or a car seat, but once they fall asleep, they then should be moved to their safe sleeping environment.
Always lay your baby on her back to sleep.
Certainly, we should all start by putting the babies on their back when you put them to sleep. Some babies will roll over, and that isn't necessarily a reason to panic. But every opportunity that comes along should be taken to put that baby on its back, at least when the baby starts out to sleep.
Put nothing but your baby in the sleep area. No loose bedding, pillows, blankets, or stuffed animals should be allowed in your baby's sleep area.
As these babies get older and they have better head control and better breathing regulation, then probably after about 12 months old, they are able to handle a blanket in the crib and not have it be a dangerous situation.
Keep your baby's face uncovered during sleep for easy breathing. Use a sleeper or sleep sack instead of a blanket.
When I had Ivan, I got a whole bunch of nice blankets, and they were so pretty that actually you want to show them off. You don't want to put them away, but I just used them for tummy time and to decorate around the room, but I don't leave any blankets in the crib because that's very dangerous for the babies.
Do not overheat your baby. Dress your baby in as much or as little clothing as you are wearing.
Sometimes parents will say, well, you know, at night, especially when it's cold, you know, I'm worried that the baby's going to be chilly at night, so don't they need a blanket at night? And so we talk to them and tell them, you know, there are sleepers, you know, dress the baby in a t-shirt and then a sleeper, or the sleep sacks is another great alternative to bunches of blankets in the crib with that baby.
Do not allow anyone to smoke around your baby. Avoid your baby's exposure to secondhand smoke.
Smoking during pregnancy increases risks of unexplained infant death in this infant period. And that the solution to that is to quit smoking during pregnancy. Of note is that smoking in the other room, and therefore decreasing the exposure to the secondhand smoke, does not eliminate this risk. While the risk may be somewhat less, if you go in the other room to smoke in a house where a baby lives, that baby is still at increased risk for unexplained death during the first year of life.
We think it's incredibly important. Anyone who's caring for your child, they understand what safe sleep is and how you want your baby taken care of, whether it's in a church nursery, whether it's in a school nursery. Any area that provides care for your child needs to clearly understand what safe sleep environment is. That's the removal of all pillows, it's the removal of toys, even though we have those who are taking care of the children that mean well, intend well, they are not fully knowledgeable of what the new safe sleep environment for your baby is. And you as a parent clearly need to make that clear to any person who's taking care of your baby.
Keep your baby safe by following these 7 simple steps. Does your baby sleep and nap in a crib, portable crib, or bassinet? Does the crib have a firm mattress and tight-fitting sheet? Is your baby placed to sleep on his back? Is everything removed from the crib? All pillows, blankets, and stuffed animals? Is your baby's face uncovered? Is your baby dressed appropriately for the temperature? Have you eliminated your baby's exposure to smoke? Answering yes to all of these questions means that you know how to keep your baby safe when sleeping. She deserves to be safe, and she deserves to be happy and healthy. So pass these tips on. By sharing safe sleep tips with others, you'll help her and many other babies in Calhoun County to live and grow. The Calhoun County Infant Safe Sleep Coalition is interested in knowing the impact of this video. If you are willing to complete a short survey, please visit www.regionalhealthalliance.com. All survey respondents will automatically be entered into a drawing. Winners will be contacted by the Regional Health Alliance.